Sometimes a patient may not be immediately eligible for a clinical trial. They might be on first-line treatment, and we identify a targeted therapy based on their genomic profile that maybe they would be available for them in 6 months or in a year. And we try our best to follow that patient so when they do progress potentially on their next line of therapy, we keep screening that trial to see, is it still open for them? Are they still eligible? Are those cohorts filled or not? Has the biomarker status changed? That, I think, is somewhere that every program struggles with. Every hospital system is trying to keep track of clinical trials, and the cohorts are rapidly opening and closing, but we do try and kind of stay ahead of that for the patients.
We have developed EMR capabilities where we're able to search what kind of patient population we are serving and able to open trials that are targeting that specific patient population. Our resources are best directed at trials where we know that we have a big patient population, and we are able to use all the data we have from precision medicine to help the biggest cohort of patients at St. Luke's.
So the clinical trial process, it sort of depends. One of the first ways we kind of sift through our own clinical trials to see, we usually have a little bit more information about where we're at in enrolling, if we're still enrolling clinical trial patients. So we look at eligibility there. We also use clinicaltrials.gov and kind of look at the inclusion and exclusion criteria, and we match them to our patient to basically do our own sort of evaluation to see if they would be eligible based off of course, the inclusion and exclusion, but also going back to their genomic results.
An average cancer program needs about 4 to 14 months to open a clinical trial. So 2 weeks is groundbreaking, and this is because of their just-in-time technology, where all the contracts and agreements are in place and the trial is ready to go as soon as we find the right mutation in the patient.